Welcome to Healing with Her, the podcast where women in medicine share bold and honest conversations from the front lines of healthcare. Step into the world of Black women medical professionals as they unpack the power of healing, the weight of care, and the beauty of showing up whole.
Welcome to Healing with Her, the podcast where women in medicine share bold, honest, and healing conversations from the front lines of healthcare. I'm your host, Dr. Brianne Wilson, and I'm thrilled to have you here. Whether you're a healthcare professional, someone passionate about wellness, or someone who is looking to gain more knowledge about your own health and well-being, you'll find stories here that resonate, educate, and inspire. This podcast was born from a shared truth. Healing isn't just about medicine. It's about connection, listening, and leadership. And who better to lead these conversations than women physicians? The information shared on Healing with Her is intended for educational and information purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of your physician or other qualified healthcare providers with any questions you may have regarding your health. The views expressed by the hosts and guests are their own and not necessarily reflect those of their institutions or employers. And now that we got that out of the way, this is February, and it is both Heart Health Month and Black History Month, as you can see by my beautiful shirt that has all the Black beautiful people on it. It's the intersection that matters, right? So as we celebrate resilience, achievement, we must confront persistent health inequities. Heart disease remains the leading cause of death in the United States and disproportionately affects the Black community. Today, I'm joined by Dr. Pamela Reed and Dr. Kiani Davis to discuss what this means clinically and what we can do. Dr. Reed and Dr. Davis, welcome.
Thank you.
And so, Dr. Davis, since this is your first time here, why don't you just tell us a little bit about yourself?
It is. First of all, I am so happy to be here amongst friends, all this magic on this couch. So I am a board-certified internal medicine physician and also preventative medicine trained, graduated from University of Buffalo, been in academia for several years, taught, was part of a federally qualified health center in which I cared for underserved communities. And incredibly excited to be here where, speaking of intersectionality, part of my research endeavors was in research, was for health inequities. And so the conversation today is really the intersectionality of all the things that I do. So I'm excited about it.
So, Dr. Reed, what patterns are you seeing in hypertension and early heart disease amongst Black patients?
So we're seeing people diagnosed earlier. We're seeing an increase in the number of people, particularly at younger ages, and not sure if that's because more people are being seen and diagnosed earlier, which is fantastic. But we do know that there is an increase overall.
So according to the American Health Association, nearly 60% of Black adults have some form of cardiovascular disease, high blood pressure, which affects nearly half of Black adults, often early and more severely. And as you alluded to, some of these diagnoses could be happening younger. What statistics tend to surprise patients most?
I think the fact that people are so young and being diagnosed with hypertension, right? People think of hypertension as I get older, this might happen to me, but it's being diagnosed in teenagers, right? Wow. And that has increased in percentage of that occurring. So I think people are most surprised that they can be diagnosed with hypertension at an early age.
What factors do you think are contributing to that at such a young age?
Oh, there's so many.
All the things, right?
Well, I mean, of course, everyone knows what you eat matters, right? How physically active you are matters. And so when you think about the younger generation, the young people being diagnosed at a younger age, we know that their physical activity has declined. It's all social media on the phones, video games, et cetera, et cetera. So decreased activity, increased weight, leading to obesity.
Yeah. What are some ways do you think that we could try to change some of that? I mean, I know, like my daughter is 4, so I'm trying at an early age to not get her used to being on a tablet, to playing outside. Do I love playing outside in the snow? No, but did I buy some snow pants so we can play outside even in the winter so I can keep her active? Yes. I'm blessed from a standpoint that she doesn't really like sweets and junk food, right? She loves a good cucumber and she loves her vegetables. So, I mean, in my opinion, just what I'm doing, just kind of raising her, one, to be more active, and kind of like you talked about, you know, getting her to eat healthier foods.
Right.
Any thoughts on that, Dr. Davis?
Life is stressful, right? I think that's, you just wake up and you're like, huh, pressure's high. But no, I think knowledge is power, right? And that's, you know, that's what I always say, you know, when you know better, you do better, right? And I think just for your 4-year-old, the same thing that I do with my kids, just always remain curious, right? Even if you don't do the right thing the first time, the second, just always remain curious, right? And as long as you're making those little tiny steps end up becoming really huge steps. And just being disciplined and just continuing to try and put one foot in front of the other.
I love that. So, Dr. Davis, not only are you an internist, you are a specialist in social and preventative medicine. Why does heart disease hit Black communities earlier and harder? And I mean, obviously some of the things that we talked about, but can you elaborate any further on why that would be?
Yeah, life. No. So, you know, one of the things that I think the reason why we tend to get affected more adversely for anything, whether it's hypertension, whether it's asthma rates, whether it's cholesterol, it's the intersectionality of all the things, right? You can't discredit what race plays in health, right? The racial fabric of America kind of lends itself to these poor outcomes, especially when it comes to African Americans, especially women. Because now you're talking about being women, and then you're also talking about being Black, right? So where do you fit into that particular equation? And when you start to peel the onion back, then you start to get into things like access, right? You know, like what Dr. Reed was saying is, you know, now when you go to the place, are they hearing you when you get there, right? Are they taking your concerns actually serious? You know, I tell my patients one of the most dangerous places for African American women to be is in my office, in this healthcare system. Because when you're not heard, bad things happen. So I think it's just a combination of all the things, which makes us a little more susceptible to these poor outcomes as well.
And even something you just brought up, because I was talking to a friend earlier about, you know, him wanting to find an African-American doctor, right? And that can be so important because you just feel more comfortable. You're able to talk to them. They understand, you know, your culture a little bit more. I know for myself, you know, sometimes I do talk to my patients like,
right. Sometimes
what is we doing? Because what are we doing?
Right. Because what?
I literally had a patient today. I was like, so you've been playing in flour today because your feet are ashy. Because you know better. We talk about this all the time. I mean, if you didn't see the last podcast about how to take care of your feet, I harp on moisturizing and taking care of your feet. And so, you know, they laugh, but they know I'm serious too at the same time. Because if you come back in here looking like this again,
don't do it.
Right. Please don't do it. Please, because I'm going to talk about you.
Right.
And I don't have a problem with that.
And as I think it was Dr. Rasha on a prior episode said, sometimes you have to go into auntie mode, right?
Yes.
And so it's that cultural understanding, and studies have shown that if you're taken care of by a provider who is of your culture, ethnicity, you have better outcomes. And so you see those poor outcomes because certainly the number of at least in the African American community, we make up only 3% of the physician population. So that contributes, right?
So just to go back to, and you brought up women, which I'm happy you did. So what does a heart attack look like, or can it look like in a woman?
So women have what they call atypical presentation, right? So everybody thinks of that central crushing chest pain as it's described, right? But in women, it can be fatigue. Like last week you were perfectly fine, and now this week you cannot like get dressed because you're so tired, and you slept perfectly fine. So it's not that you're tired because you did 10 things and you slept poorly. You did nothing, you slept well, and you're still tired. It's shortness of breath. You used to be able to clean your house, go to work, take care of your kids, and not be short of breath. And now you can't walk up a flight of stairs without being short of breath. GI, there can be nausea and vomiting, which you think, oh, maybe it's like food poisoning, maybe it's something I ate, or abdominal pain, pain in upper body, jaw, shoulders, can be a woman's what we call angina, sign of the heart not getting enough blood flow.
So if we do have a Black woman or somebody in our lives, or even ourselves, and we go to our doctors and we're telling them these things, and we feel like we're not being heard or they're ignoring us, what advice would you give?
Find a new doctor.
That part. Just find a whole new one.
Yeah, and I find even when I used to work in a group practice, right? So I used to work in a group practice. It was myself and 5 other white men, and most of the patients didn't realize that they can switch a doctor.
Yes,
And I'm not really sure where that comes from. The authoritarian part of it, right? It's like they view the title, the name, the doctor as this authoritarian, and I don't want to make you upset, right? So I'm just going to sit here and take this treatment. And then we, especially Black women, just tend to kind of just say, okay, you know, I'll just fix it later, right? Or I'll, you know what I mean? And you deserve more, right? We are begging for what other people think is the expectation. Stop doing that, right? You deserve more.
You do deserve more. And you do not, I repeat, you do not have to settle for the doctor that you have. If you feel like you're not being heard or you're not being listened to, or you can switch. It's your right. You can do that.
you absolutely can.
Yes, thank you. Okay, so we're going to go a little bit into family history.
Yes.
Right? It's so important, especially in the Black culture, which I feel like the history has been so taboo. Like, so some of us don't even know the family history because it just wasn't talked about, or it was looked at as, I don't know what it was looked at as, the devil or something. It was looked at as something. And so they would never know. Right. So it was very difficult to know if your family member had heart disease or cancers. And so it would make it difficult for us to kind of, let our doctors know and let it know if it's like a predetermination or things like that. So if a parent had a heart attack at 50, what does that mean for risk for us, Dr. Davis?
Oh, that changes everything, right? I think there's the signs and the symptoms that Dr. Reed talked about, and then there's things that make our ears perk up, right? When you say stuff like, oh, my father had a massive heart attack at 50, and you're like, whoa, hold on, roll that back. Let's talk about that. But I think it definitely changes the fact that if you come in and you have this borderline blood pressure, right? And let's say this borderline blood pressure's, you're 42 and it's 138 over 90, and I know that it's supposed to be less than 140 over 90 because those are the guidelines. And then you hit me with my dad died of a massive heart attack. So this mild blood pressure that maybe I'm going to tell you to come back in 2 weeks or a month changes things. Now it changes my management. Maybe I want to get an EKG on you. Maybe, you know what, I do want to start that blood pressure medication a little bit earlier, because one of the things is that if somebody has high blood pressure, once you make them normotensive, meaning that their blood pressure is back to normal or less than where it's supposed to be, their risk of a heart attack or a stroke is the same as somebody who doesn't have any blood pressure issues at all. So it's the fight against now time of preventing that event from actually happening. So it's more than just that little thing happened. It really changes your management, your treatment, and the things that we do moving forward.
And so that's why it's so important to try to at least know, some of your
Something.
family history.
Right.
Ask the questions of your parents, ask the grandparents if you can, to try to find out that information. How early should screening start?
So different caveats, right?
Mm-hmm.
If you don't have a family history of diabetes, hypertension, heart disease, then you can start screening at 40, right? If you have a history of those things, screening needs to start much earlier. And I'm a proponent of everyone it's not written that you have to have an annual physical, right? But if you have a family history of multiple chronic diseases, you really, no matter how old you are, if you're in your 20s, in your 30s, you should be seeing someone and having your blood pressure taken at least once a year. You should have your cholesterol levels checked at least once every 5 years. You have to start doing that at an earlier age because your risk factors, as Dr. Davis said, you're twice as likely to have some type of cardiac event younger if someone in your family had a history of having something less than 50 years old.
Mm-hmm. So it's interesting. I had a patient literally this week, a younger patient who saw his primary and was going to be put on meds. And then, just talking to him more, his dad died of a heart attack when he was young. And he was kind of against being put on medication because he couldn't understand why he should be put on something when he is okay.
Yeah.
So how do you navigate that person? I mean, you clearly, like you said before, it's like red flags, or when you hear that there is a family history. And at some point I'm like, listen, you grown. I don't really know what to tell you. I can only give you the information, and what you do with it is what you choose to do with it. You go and you advocate and you try to explain the science and you do all the things. But like, how do you doctors handle it? I know, right?
No, I think it's the same thing. I'm not here to convince you of anything, right? And this is what I tell people. That's not my job to convince you. I know a body, you know your body. We're going to meet somewhere in the middle. And that's it. And sometimes the thing is that it doesn't happen off the first try. It's everything's a relationship. Just because I tell you to do something doesn't mean that you're supposed to do it, right? So it may take me a second time or a third time, but what people eventually realize is that they trust you because you're doing the work with them, right? And I think that's always the biggest thing. I'm not here to tell you to take it. This is a compromise. Let me lay out your options, and then you choose what you want to do, right? It's my job to work within those, those constraints. But at some point, like you said, you are grown. This is why I'm an internist. You said that at the beginning, not a pediatrician. I love my peds people. Don't come for me. But you're grown. But I think it's important to have conversations with people. And I think sometimes as Black women, when we go to the doctors, we don't have those conversations because people sometimes don't see us as valuable or having knowledge and dominion over our own body, right? So part of it is just finding out what you're interested in. How do I tie my needs to what you're interested in, and what's important to you?
Right. And you have to understand the person's values, right? What is of value to them? And then education, right? So sometimes people are refusing to follow a recommendation because they were not given enough education to understand why it's important. And so I think that, and like Dr. Davis said, it's really developing those relationships over time where people trust and understand that you are working with them because you care about their health. You care about helping them live well, as we've talked about in the past, not just health, but wellness.
And I feel like trying to manage unrealistic expectations. And again, I'm a podiatrist, but I deal with all kinds of things, right? All the people. And I'm not against holistic medicine at all, right? I do understand a place for it.
Yes.
when it's appropriate. But again, I can't manage if your blood pressure is 200 over 100. Peppermint oil isn't going to work.
Listen, the beet juice, if somebody tells me about beet juice one more time, I said, listen, take your amlodipine with the beet juice. I don't care.
Take it together.
Right? Just take it together. I don't care. No, you're right. And I always say, somewhere preventative medicine is not homeopathic medicine. And I think that's one of the things that I have to clear up all the time. My goal is to prevent all the bad things from happening, right? But I do that with allopathic medicine. However, I'm also grown enough to know that they didn't just create Western medicine when I got my MD, right? There has been, my family is from the Caribbean. There's been medicine men since, forever, right? So with that said, there's a happy medium, right? For someone who's young and healthy and doesn't have this really bad family history, if you want to take your beet juice because your blood pressure is 130 over 90 and you're kind of tiptoeing on the line, you do that, right? But don't do it when it's 200 over 100, right? When we start doing some of those lifestyle stuff, if you want to say that, after I put you on these one medication, there's two medications, and you want to do your beet juice to keep you from the third medication, you do that. I'll play that game with you too. But there's a time and a place, and not saying that it's wrong, but it's making sure that it's for the right person.
Yes.
So Dr. Davis, can you explain weathering and how does chronic stress biologically affect blood pressure and inflation?
That's a whole.
I was going to say, Dr. Wilson. That's I was just going to say that. That's like a whole nother.
Right.
Give me the cliff notes.
All right. Look. All right.
Give me the cliff notes.
So the first part, social determinants of health. So what is social determinants of health? So it's all the non-medical things that actually contribute to one's health. That's my very scholastic definition of it. Right. Those would be where you live, where you work, where you play, everything. Right. 80% of the totality of your health are things that don't really, it's where you live, where you play. Only 20% is things that you can somewhat affect. 10% is genetic, and then the other 10% is what we all do on this couch, right? Coming into our office and actually seeking care. Access to, medications, where you're living, your zip code, obesity, incarceration, education. All of those things are a component. Racism are all things that determine your health. All right. So now we have social determinants of health. So what is weathering? If you go back to kind of what I said earlier, racism is baked into the pie of America, right? It's baked into the pie of the world. So what happens is what we've known, and over a course of a body of literature with Dr. Geronimus in the early 90s, and she got death threats and people called for her to resign. It built upon a knowledge that McEwen and his colleagues did, where they actually looked at cortisol levels, and they looked at epinephrine, which are all different hormones that actually kind of rev up the body. And they wanted to look at just on a cellular level what happened. So she said, you know what, I think that this can also play a part in also why we're seeing some of these health inequities and the disparities amongst African Americans, right? Like what is this? So she actually, over a series of literature, actually demonstrated that chronic stressors, toxic stress, so the waking up every day, the can I touch your hair, right? Or, Dr. Wilson, your tone was off. What did you mean? Why don't you smile? All those little things start to just pick and nag at you. But over time, we've learned that it actually accelerates the aging of your DNA. So you have two different types of ages. You have the age that, so I have a birthday coming up on Thursday, but who's counting?
Happy birthday.
Thank you. It's your birthday. But there's every time I have a trip around the sun, there's that chronological age. And then you have the age of your DNA. So compared to me as a Black African-American woman to my white counterpart, my inside DNA is actually 7.5 to 10 years older than my white counterpart. So what does that mean? A 40-year-old Black woman is actually 47 years old inside of her body. And why is that important? When our cellular starts to actually increase in age, it accelerates disease process, diabetes, hypertension, obesity. So the truth of the matter is some of these things that we think that we just have all control over, some of it we don't. It's our environment coupled with our genes.
That was amazing.
Thank you. I appreciate it.
That was good. So, Dr. Davis, if you designed the ideal day for heart health, what would it include? And how much exercise is enough?
Right? Huh? Like, huh? Is it time? Yeah. You know what? The thing for heart health I would like is I would love for people to continue to have conversations about all the atypical or indirect things that actually relate to our heart. We talk about blood pressure, but you have things like menopause, perimenopause, estrogen levels, right? Lack of sleep. All of this contributes to your heart health. And to go back to kind of what is enough exercise. At this point, ain't nobody doing enough exercise if you are not being conscious of it. But, I really do start with the easy stuff, right? The 150 minutes of, of moderate intensity activity, right? And even, whole nother podcast, but how do you even get to moderate intensity activity, right? I mean, I walked up some stairs and was like, oh, Jesus, that was a lot, right? But it's not moderate intensity. But there's actually new literature coming. I don't know if you guys saw it, about micro snacks for exercise. Have you seen this?
I have not.
I said, I can get down with this. So it's actually looking at doing like quick 15-minute bursts of something. So like if you're charting or doing something, you just hit your squats for about 15 minutes going about your day. And you do this over the course of a day, like 6 or 7 times. I said, I can wrap my mind around that. So so I will do some more research and come back on it. But micro snack exercising is starting to be a thing. Don't you love it? Micro snacks.
It sounds delicious.
Doesn't it?
I love it. All right, so Dr. Reed, so we know the Black community and our food, right? Right? We all said it at the same time. But what culturally realistic dietary shifts can we would do to help reduce our risk or help, with our heart health?
Right. So, food is community.
Right.
Right. And it's so intricate to your identity and culture, right? And so I don't tell people to stop eating anything. What I ask them to do is to prepare it differently, right? So, we grew up with those greens with neck bones, right? Or ham hocks, right? And I say, can you maybe do them with peppers and onions and garlic to increase the taste? Or if you have to have the meat, can you do a smoked turkey neck? And so it's just shifting how you're preparing it, not getting rid of it, because some things you need to get rid of. Well, nobody should have been eating those.
Do you see what I'm saying? I'm sorry. I can't.
But to eat that shifting how you prepare it is what I try to educate people on. And there's tons of recipes out there. I actually just sent a vegan cookbook to my cousin that was written by a young Black woman, and it has all of these great cultural
how nice.
Yes, recipes, right? So you get that sense of the flavor. You know what I mean?
Yes. It's just small changes can make a big difference. So with the few minutes we have left, I would like you ladies to just maybe give a little summary of maybe what you think the main takeaway should be for our listeners today. And I'll start with you, Dr. Davis.
Yeah, I think the things that you can control and maybe the things that you don't control, right? So the don't control part, I would say, know your numbers, right? So when you come into your doctor's office, know generally where it should be, right? Ask about your blood pressure. If that medical assistant brings you in there and they didn't really give it to you, ask somebody about your blood, your blood pressure, know your numbers, your cholesterol. Like Dr. Reed said, it should be checked every, at minimum every 5 years, but know what those numbers are, that somebody should sit down with you, number for number, and let you know what that is. So know your numbers. And then the other part of it is that we like to say children should stay in a child's place, right? That's not true. We need to start having open dialogue and conversations with each other about our health, because something that someone may save somebody else's life.
I love that.
Right. And on our podcast, we're always talking about wellness, right? Physical wellness, mental wellness, spiritual wellness. And so I think the takeaway from a discussion on heart disease is those things that we've talked about in the past are applicable to this. You need to get enough sleep.
Yes.
Right? You need to try to eat well, right? You need to exercise, right? You need to meditate, be mindful. Those are the things that will help decrease some of your risks if you're doing those things. And so that whole wellness concept.
This has been an awesome episode. Thank you, Dr. Davis. Thank you, Dr. Reed. Heart Health Month calls us to awareness. Black History Month calls us to responsibility. And to our listeners, know your numbers, know your history, and protect your heart. Again, the information shared on Healing with Her is intended for educational and information purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of your physician or other qualified healthcare provider with any questions you may have regarding your health. The views expressed by Healing with Her guests are their own and do not necessarily reflect those of their institutions or employers. Thank you for joining us.